When we think of acne, we usually think of teenagers, but a lot of adults continue to struggle with acne well into their 20s, 30s, and even 40s. Today, I'm joined by Dr. Faisal Haque, a physician and a dermatologist who has practiced in Pakistan, the United Kingdom, and the United States, with around 15 years of experience in dermatology alone. Dr. Faisal has taken his qualifications from top schools around the world, including Imperial College in the UK and Cardiff University in the UK. Dr. Huck, let's start with the most obvious question. Why do adults still get acne?
Hey, hi Adil, how you doing? Thank you for inviting me. Hoping we could touch base upon few misconceptions. A, every lesion on the face is not acne. There has to be
Mhm.
a differential diagnosis between acne, folliculitis, seborrheic dermatitis. So to answer your question in a bit of detail, every zit or lesion on the face should not be taken as acne again. And for teenagers or even people below 25, a bit of acne is never a bad thing. It is just an announcement that their hormones or the androgenic hormones are peaking in the right direction
Yeah,
and they're supplying a bit more sort of oil to their glands. So, for starters, a bit of tolerance against acne has to be built.
right.
Now, to rephrase that, the origin of acne is usually almost always from seborrhea, which is a term for excessive skin oil. Now, what that skin oil does in response to your hormones is that it occludes or blocks your hair follicles. And then the causative organism of acne that usually sort of, proliferates there. And then you have a zit or a pimple or, what we clinically call acne.
Yeah,
So, for starters, again, acne has no age limit. Infants can be born with acne. Teenagers are known to have a bit of acne, but
mhm,
it can very well extend into later life as well, just because our different hormonal fluctuations can cause an eruption in acne during all sorts of, decades of our
yeah,
lives.
yeah,
So, as the basic thing goes, the hair follicles or the hormones, they need to be regulated slightly in order for us to sort of jump to your next question about its prevention and cure.
mm. Okay, perfect. Dr. Huck, but why doesn't acne simply disappear when puberty is over? What is actually happening in the skin when an adult develops acne?
You see, under hormonal challenge, whenever we start to from adolescence into puberty, uh, the respective male and the female hormones, they kind of peak up. Okay, and the first supply is excessive production of oil.
Uh-huh.
Now, whenever, through a lifestyle habit or food intake, plus different individuals, who are, under stress, they secrete excessive amount of oil. So oil, we have to understand that oil is the precursor for all acne.
Mm,
So to repeat your question, to answer your question more in detail, um, we have to strike a fine balance between prevention versus cure. A, this myth about excessive face washing and treating the acne right when it starts, fine. It is more about a habit because habits are more powerful. So if you're able to sort of, keep your clean reasonably oil free, okay, through a
yeah,
simple sort of face wash, because, I would like to reiterate here that the multi-million dollar face wash industries, having benzoyl peroxide or tretinoins or whatever, it is largely a misnomer. So nothing that normal soap and water cannot do. Okay. So excessive compulsive skin washing is not the answer because A, you need to have the right pH balance.
Mm-hmm.
And, during quest of our excessive face washes, we just kind of destroy the first protective layer of the skin, which is known as stratum corneum, which is pretty invisible. Once you
Mm-hmm.
do that, your skin is more prone to acne. Now, as I said, I mean, different people respond differently to acne, and the only emergent condition for treating acne is either excessive hyperpigmentation post acne or the propensity of the skin to start developing scars. Now, that is
Right.
here we need to start. Okay.
Yeah.
So, I mean, if we just, I mean, during very simple terms, if we just sort of categorize acne, if it's in the T zone, which involves your forehead, nose,
Mm-hmm.
and the chin, okay,
Yeah.
it is usually androgenic acne. And if it's in the U zone, I mean, the jowls and the cheek and the beard, that is usually folliculitis or seborrheic dermatitis.
Okay.
So this common myth, I mean, since I'll just give you an example. You're a
Yeah.
young male. Okay, when you started off, you were probably secreting something like 900 to 1200 nanograms of testosterone. So you are bound to get some acne. If you're not getting acne or excessively sort of oily skin when you get up, that is the first sign that you're under hormonal stress. Okay,
Hmm.
so if you start, if you let these acneiform lesions continue past a certain point, if we grade them from 1 to 10, so usually a 2 or a 3 can only be controlled by a topical, something like a benzoyl peroxide or a vitamin A analog, and usually it'll control your acne. But
Right.
if your acneiform lesions continue way past that, and upon healing they leave excessive or noticeable amount of hyperpigmentation or acne
Yeah.
scarring, that is when you need to cross the bridge if you want to treat it orally or through other modalities, which could be microneedling or lasers or anything. But a vast majority, they just panic when they see 4 or 5 zits. Okay, that is not the great case to treat. You need to, I mean, just basic oil control. Honestly, you are what you eat. Excessive
Yeah, that's true.
spice,
Yeah.
oil, excessive meat intake. So
Yeah.
that obviously accelerates the amount of sebum production. And
Yeah.
for girls especially, if they do not take the makeup off and occlude it through methods, through heavy oils or heavy
Yeah.
makeup products,
Yeah.
occlusion gives rise to acne. Yeah.
Very interesting. Very interesting. Thank you, Dr. Faisal. Now, before we get back to the conversation, this episode is brought to you by ZoomMD, a digital healthcare platform helping patients discover and connect with healthcare providers more conveniently. To find out more on ZoomMD, we will leave all the information in the description of this video below. And now,
Mhm.
let's get back to the conversation. Dr. Faisal, whenever an adult gets acne, people immediately say, oh, you know what, it's hormonal. Now, how much of adult acne really is hormonal? And when should someone actually be concerned that something else might be going on?
Yeah. So, Adil, I appreciate your introduction on Zoom MD. It's a very good effort, and hopefully, people would get more aware. See, Adil, acne, only 25% of the manifestation of hormonal acne is on your face. Okay, so there's got to be, okay, if face is 15% of your body or less, okay, you've got other signs in your body as well. So for
Mm-hmm.
males, they've got to check the other parts of the body as well, something like the back, okay, or the armpits, or the groin for that matter. I mean, based upon a singular population of maybe 10 odd zits on the face and the forehead is not enough to say that you have hormonal acne. Okay. This is androgenic acne, which is again, part of hormonal acne, but it's
Yeah.
necessarily not a pathology. For females, it is different. Okay, for females, usually all the manifestation is around the U line, but that is
Mm-hmm.
in combination with excessive hair growth, a body metabolic syndrome, which is something similar to which gives you weight gain. Okay, hoarseness of voice and stuff. So all acne initially, okay, is hormonal.
Yeah.
Okay, but if it manifests on other parts of the body as well through excessive hair growth, you know, body acne, chest and the back, along with weight gain, that is termed as a hormonal acne, and that is when you should actively seek medical help. They would run a battery of tests, okay, and then again, the treatment remains anti-acne medications
Yeah.
usually. So more or less, based upon the severity, or if we draw a ladder of anti-acne treatments, first being topical,
Yeah.
creams, secondary being oral, and the third being, a combination.
Yeah.
So, we can very well ascertain what hormonal versus normal acne is.
So basically, you're saying that acne sometimes is our skin giving us a clue that there's something happening inside the body. Is that true?
Yes, kind of. Yeah. Not entirely, but kind of. I
Yeah.
mean, one should not panic at the happening at the occurrence of four zits and call it hormonal,
Uh,
unless you feel there is something else along with the metabolic syndrome of the body, along with facial hair growth. Okay. And for men, similar acne in the scalp and beard. Okay.
yeah.
Then you can consult your physician, and then he's going to run a profile, and based upon his experience, going to declare it a hormonal acne.
Okay. Interesting. Interesting. Dr. Hug, let's talk about everyday life now. People blame stress, chocolate, dairy, oily food, makeup, skincare products, and some people wash their face 10 times a day trying to get rid of acne. What are some of the biggest mistakes adults make when they're trying to treat their acne themselves?
Yeah. That's a good question. See, we're a product of our surroundings. Okay, some people are naturally high stressors, and some people are less. Okay, so running to a shop, okay, ordering. I mean, injudiciously using oral tretinoins or oral retinoids. That is kind of something that needs to be avoided. But coming back to your question again, to be more specific, as I gave you a grading of something like a 1 to 10, you've got to learn to grade your acne through your own self education, because you could have a very aggressive practitioner as well. Okay,
Yeah.
who would simply start you to give you startling results and to be called the best doctor. He does not want to put you through the paces
Yeah.
of normal acne treatment protocol. So again, food, I would say 10%. Okay. If it's regulated, excessive face washing, I mean, fine, depends upon your environment. If it's excessively humid, I do not recommend washing face more than 3 to 4 times a day. Okay. That usually happens through our, religious protocol as well.
Yeah.
But, excessive washing just takes care away of the protective mechanism that the nature has given you. So at
Hmm.
best, if it could be soap and water, could be a benzoyl peroxide face wash, but just lightly scrub it. That
Yeah.
that forms the basis of the application of the wonder drug, which is a topical Skin A or a topical isotretinoin cream. That usually what happens is it just increases the skin turnover of your cells. So dead cells die. Okay, if they tend to stick to your skin, they act as a prelude to more acne and an uneven
Uh-huh.
skin. So
Uh-huh.
if there's a decent turnover of the cellular skin, okay, you've
Yeah.
got better chances that your oil glands are going to be less clogged, and your acne is going to be less severe. So first of all, you start off with good skin turnover through a face wash. Then, if you grade your acne something around between 3 to 5 out of 10, you
Yeah.
could do the topical tretinoin cream. Okay. Usually, my protocol is something which is vitamin A based, a very thin pea size. Sorry, I would say a pinhead size application each side of the face in the T zone or the U zone. And then it's usually taken at night. And sometimes it you know, causes purging as well. So one thing is very important. As soon as you start these vitamin A creams, there is purging. What is happening is they are impending acne, which is about to appear in your skin. That usually gets purged out at a faster rate. So, once the purging part is over, that is when your skin starts to really respond to the topical to the topical treatments. So it is very
Uh-huh.
important not to panic during that purging treatment. And then you continue on a 4 day on and 1 day off cycle. Okay, you
Yeah.
usually apply the topical retinoids as a sandwich method. Okay,
Uh-huh.
you
Uh-huh.
face wash. Okay,
Uh-huh.
then a very thin application applied by a very thin smear of hypoallergenic, aqueous cream. Okay, very thin. So once you continue that, that's a good habit because it's going to keep the balance of the pH, balance of your skin in check.
Yeah.
Then the oil clogging is less, and whenever the hormone spurting usually happens at night. So you have one watchdog in your skin which is constantly balancing out things. So that's how it is.
Very interesting. And this has been a great
Mm.
conversation so far. Dr. Faisal, we're now going to move on to the last question of this interview. You spent about 15 years specializing in dermatology and have worked across Pakistan, the UK, and the US. Um, if you could correct one misconception people have about adult acne, what would that be?
Yeah, that would be that acne is usually between, just for the teenagers. No,
Yeah.
that is not the case. It can happen at any age. Okay. Number two, lifestyle matters a lot. Okay. All the processed meats, all the, donuts and chocolates, okay, that you guys stuff with late at night. Yes, they do manifest in a way, but only by 5 to 7%.
Yeah.
Secondly, third, hydration plays a very important part. You guys could do, if anybody's consuming lots of water, their normal body secretions, they're going to be less toxic. Okay. So stay hydrated as well. And yes, treat acne to a point that you don't have to run to a doctor immediately. Just grade it, mild, moderate, medium. Somewhere between mild to moderate, you treat it yourself, okay,
Yeah.
and then rush to the doctor once it crosses the moderate point.
Yeah.
Fourth point is about treatment. Okay, every acne scar is going to leave behind a hyperpigmented mark or some form of a temporary scar. Okay, that should not be treated with a laser or a microneedling device. Just give it time. Persist with topical tretinoin or a skin A treatment, you will see results over a period of time that might sort of cut short your visits to the physician.
That was very interesting. Dr. Huck, I think that's a great place to end this interview. If you are dealing with persistent acne as an adult, don't just assume it's something you have to live with. Understanding what's actually causing it is the first step. Dr. Faisal Huck, thank you so much for joining us and giving us the time.
Thank you for
Thank
having
you.
me. Appreciate it. Thank you,
Appreciate
guys.
it. Take
Okay.
care. Cheers.
Bye.